And I was diagnosed in the fall of 2005 with low risk MDS, and it's pretty much stayed low risk for all this time, up and down blood counts, but pretty much the same. I'm a clinical social worker, and I work 3 days a week at a private nonprofit outpatient counseling center. And so I do a lot of work with trauma, loss, and grief. He and his wife came in, and he was explaining to me that he'd been diagnosed with cancer about a year and a half earlier. And as the conversation went on, he told me that he had MDS and that he was had been diagnosed in a low risk category, and that his condition had really progressed. And I have to admit, this being a very rare disease, that my job was sort of not to fall off my chair, because I was really, really shocked at this was the first time I'd even met anyone who had the same disease I did. And I really questioned whether I would be able to work with this couple. And I was very honest in sharing with them as the session went on that I had the same disease and been diagnosed about the same period of time. And I asked them if they would rather I referred them to someone else. But they said no. They felt that because I had the disease too, I would really understand. One of the meaningful things to me is I really can be there in a different way with people who are facing life-threatening diseases in a way that I probably would not have been able to understand. So I think partly for me, being able to help people is probably something that I feel very grateful for. I have taken mindfulness meditation classes, and although I haven't done it, some have been virtual, and they've had very good results from that. And we also have small group meetings in between monthly large group meetings, and they're thinking about doing some of those virtual too, because again, it's geographic and time and busy. And one of the things that I've done since I was diagnosed is really building a wonderful support system. I have excellent medical care, and I have an excellent support system, and that is no accident. I've worked very hard, and I think support is really everything.